once breast milk commences or once lactation commences, the colostrum is the first milk that comes out, or the first breast milk that the body releases or the brain releases into the breast, and that is yellowish nature. Most mothers do not understand how important colostrum is. Now, when you see that your breast milk is bringing out is yellowish in color, you don't have to be afraid, because that yellowish milk is called colostrum, and that is like the first immunization that your baby gets. Very, 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 very important that your baby takes that colostrum. Welcome back to my YouTube channel. My name is Priscilla. I'm a registered and licensed healthcare practitioner, like you already know. And on this channel, I share tips around motherhood, parenting, maternal and child health. Welcome back to yet another video. Today, I will be discussing things that you should know as a nursing mother. Stay tuned. If you haven't subscribed to my channel, take some time to hit the subscribe button and hit the notification bell so that you get notified whenever I post a new video. Let's dive right into the video. As a nursing mom, there are some physical changes that you should expect. One of these is the commencement of lactation or the onset of lactation. Most women do not lactate immediately after birth, after childbirth. Some women do. If you fall into the category of women who do not lactate immediately after birth, you don't need to worry. It is perfectly okay. It is normal. It's not something that you should panic about. Just give it time. It will come. And you have to always put the baby to breast. Even if the breast milk is not coming yet, don't fail to put the baby to breast, because as the baby starts to latch, it signals the brain to start processing and releasing the breast milk. Now, you can also there are some things you can also do to enhance the possibility of breast milk coming on time. You can take more of tea, do a lot of tea. As a mom who just gave birth, you don't need to take your tea with a very tiny cup like this. No, this is not what you should use to take tea as a nursing mom or a mom who just gave birth. You need to look for a bigger cup so that it will be quite a lot. That way, it will help the breast milk to come on time. Then, pap will also help you. Take a lot of pap with milk, preferably liquid milk. It's also going to help you. There are also cookies that help breast milk to come, that will help stimulate breast milk to come faster. You can also use those breast milk cookies or breastfeeding cookies. Now, let's not forget that once breast milk commences or once lactation commences, the colostrum is the first milk that comes out, or the first breast milk that the body releases or the brain releases into the breast, and that is yellowish nature. Most mothers do not understand how important colostrum is. Now, when you see that your breast milk is bringing out is yellowish in color, you don't have to be afraid, because that yellowish milk is called colostrum, and that is like the first immunization that your baby gets. Very, 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 very important that your baby takes that colostrum. Make sure you don't deprive your baby of colostrum. It's very important because it's the first immunization, like the first protection that the baby gets to fight for his or herself now that he's now or she's now in the world. So that colostrum is very, very important. It is packed with nutrients. It is packed with vitamins. It is very, very nutritious and very protective for your baby. So don't fail to let your baby have that colostrum until it finishes and the white breast milk starts coming out. Another physical change you should expect as a nursing mom is the engorgement of the breast. Once lactation starts very, very well and the baby is latching well, you see that the breast becomes engorged. Most times it is so heavy that it can be inconveniencing. It can feel a little bit uncomfortable. So in this case, you should try to express part of the breast milk so that you can relieve yourself of the weight and the discomfort. Okay, while you also breastfeed the baby on demand. So you should expect that discomfort is normal, the engorgement of the breast is normal. Another physical changes to expect as a nursing mom is the let down reflex. And this happens when lactation has commenced in full and very effective. You feel that tightening sensation or tingling sensation in your breast when breast milk is being released. It is perfectly normal and it occurs when lactation has begun in effect. It is normal. Some women feel it strongly, while some barely feel it. It depends on individual. Then there is sore nipples. This most cases happens at the initial time when the baby starts sucking. In effect, when the baby starts latching very well, you feel that there is a sore-like sensation. You feel there is a sore in your nipple, and it causes pain. It causes discomfort. Now, I want to say that the way your baby latches is very, very important. It plays a role to whether or not you will have these sore nipples. Okay. Now, what is latching? Latching means the way that your baby connects to your breast, the way your baby fits his or her mouth into your breast, the nipple and the areola. Now, you should understand that when you want to put your baby to breast, don't just introduce the nipple only. You should let the mouth of your baby cover the areola. That is the dark parts, the dark area surrounding the nipple. That way, there will be a firm grip, okay? So that the pressure will not be only on the nipple alone. That can predispose you to sore nipples, all right? So you should allow your baby to latch on your breast very well by making sure your baby's mouth is not only on the nipple but on the areola as well. Another thing you should expect as a nursing mom is leaking. Breast milk may leak in between feeds or when there is a letdown, when letdown occurs. Remember, I said the letdown reflex is the sensation you feel when the brain or the body releases breast milk into the breast. Now, when letdown occurs, breast milk may leak. And again, when you hear your baby cry, okay, you can also experience leaking from the breast. You know those days where they say when you are outside, when you are far from your baby, maybe you are in the market, you went to shop, or you just went for an errand, and you feel that your breast is leaking, you feel that sensation and your breast start leaking. You say, oh, my baby is crying. It tells you that your baby needs to suck. All right. I don't know if that is superstition or if it is real. I want to share your thoughts in the comment section. If you have experienced it as a mom, please share your comments in the comment section. Now, most importantly is the contraction. As a mom who just gave birth, at times you just notice that as your baby is sucking, you feel pain in your stomach. You feel pain in your womb. You feel your womb contracting. It's very, very normal. And that is why breastfeeding is very important. It's very important to put your baby to breast and initiate lactation after childbirth, because it is a natural way of contracting the uterus to get rid of the remains of childbirth, all right, so that you can bleed very well, you can expel all the retained products and the remains of childbirth, so you don't have bleeding subsequently. All right, so breastfeeding helps to contract the wombs and the womb and help you to expel the remains of childbirth. So these are the physical things that you should expect after having your baby, after childbirth. So if this video was useful, was helpful to you, please give me a like in the comment section. Give me a like and leave me a comment in the comment section. If you haven't subscribed, please do where to subscribe so that you can support my channel. I'll see you again in my next one.